Aloha guys, this is Dr. Tom coming back at you. The last recording I made, which was yesterday, I had trouble with. Today everything's gone smoothly, knock on wood. Hold on, I gotta adjust my chair though. Okay, alright, yes. So we're gonna pick up right where we left off. Chapters 26 and 27 for pathophysiology. Female reproductive terms. Menarche, first period of menstrual bleeding during puberty. These are important terms to know, guys. So menarche is when the young lady has her first period. Menses is the more appropriate medical term for menstrual period. Menopause is when women are at the end of their reproductive life, usually in the 40s or 50s. Decrease in ovarian hormones, menstrual periods decrease and eventually cease. Other systemic effects like hot flashes and things. So menopause is when they stop having periods and are capable of becoming pregnant. Methods of birth control. The barrier method, like condoms. Hormonal method, like birth control pills. Surgical method, like having the tubes tied or a vasectomy in the male. Intrauterine devices like the IUDs. Behavioral methods. I'm assuming that would be like keeping careful track of when you're ovulating and measuring temperature and things like that. I'm not sure how well that sort of thing works, but I'd say if depending on the individual female, it could be, if it kept careful tabs on it, could be effective. All right, let's see. We just mentioned all these. Here's the male. The vas deferens are cut in the case of a vasectomy. In the female, when their tubes are tied, they cut them and tie them off where the ova cannot get past that point and the sperm cannot get past that point. These are all very effective. They test later to make sure they're quite effective, and they can be reversed, although it's not a simple matter, but they can be. But an individual would need to make up their mind that's what they want to do. Questions? Okay, are there any questions out there? Okay. Fertilization, sperm and egg unite when near mid-cycle of ovulation. Where? First third of the fallopian tube. Remember we said that fertilization takes place in the oviduct. How? At intercourse, sperm swim to the fallopian tube. At fertilization, nuclei of sperm and eggs unite. The result is the zygote. It has 46 chromosomes because it's gotten 23 from the sperm cell and 23 from the egg. Prenatal development. 3 periods. Early embryonic is the first 2 weeks. Embryonic is weeks 3 to 8. Fetal is week 9 to birth. Pregnancy from conception to birth is 38 weeks or 9 months. It's divided into trimesters. The first trimester, second trimester, and so on. Prenatal development includes cleavage, where cell division occurs by mitosis, like all cells except for the sex cells. Growth, the size of the cells increase. Morphogenesis, shaping of the cell cluster. It's like you're making a sculpture out of clay and it's starting to come together. Morpho always means the shape of something, guys. Differentiation. Cellular specialization is starting to occur. We're starting to see the very, very earliest examples of what will later be major structures like the spine. Early embryonic period. Zygote is the name of the fertilized ovum. Blastomere is result from mitosis. Okay. When it's reached 16 cells, it's called a morula. Blastocysts, early and late. Okay, it's starting to fill in and grow more. So here's the moment of conception. Here's only one, under normal conditions, only one sperm cell can penetrate the membrane of the egg. And then it starts dividing through regular mitotic division. Once it gets 16, it's the morula. Now remember, guys, too, this is a geometric proportion of growth. So it's 1, 2, and then 4, and then 8, and then 16, and then 32, and 64, and so on. It's like a snowball. trophoblastic cells at implantation. So eventually, fertilization occurs here. It will migrate, the zygote will migrate down and implant itself into the endometrial wall of the uterus. Twinning. Monozygotic or identical twins develop from the same zygote. So that's why they have exactly the same genetic information. Dizygotic or fraternal twins develop from two different zygotes. So they're just like an ordinary sibling pair. They can be of the same sex, or they can be a boy and a girl. But they incubate in the uterus at the same time. So identical have exactly the same genetic information. Fraternal have no more of the same than any ordinary brother and sister or brother would have. Embryonic period. Amnionic sac fluid. The fetus floats around here in this sac fluid. Chorionic, Villi, placenta. The placenta is of extreme importance. That's where oxygen, waste products, and nutrients and all pass back and forth between the mother and carbon dioxide. Yolk sac, red blood cells, immature sex cells. Remember, we said the female fetus, the eggs develop while they're in utero, even though they won't be used for years. Lactose, urinary bladder, umbilical cord. Okay, of course, the umbilical cord attaches the fetus to the placenta. So, of course, the fetus in fluid, and it doesn't use its lungs, and it only uses part of its heart. So after birth, then that'll be very quickly expanded. Why? Because the fetus is not breathing; it's getting its oxygen from the mother via the placenta. Diagnostic tests for birth defects. Amniocentesis. They go through the abdomen with a needle, syringe, and go in and suck out some of the amniotic fluid. Then there'll be cells from the fetus in that, guys, and then they can analyze them to see if everything's looking good. For example, in Down syndrome, it's more common in middle-aged women. So if there's reason to suspect that the fetus might be a Down's fetus, and it's trisomy of chromosome 21, I think. There's an extra chromosome there. It's a birth defect. Then a decision can be made whether to maintain the pregnancy or not. Now, that may sound cruel, but a Down syndrome child is something that's going to require lifetime care and things like that. I think they're wonderful people, so, but in any case, this lets them know that whether it is or not, if it's suspected. We won't argue about whether you should terminate a pregnancy or anything. Chorionic villi and placenta. Placenta form when going to penetrate endometrium, site for fetal eating, breathing, excreting, secretes hormones. Umbilical cord joins the fetus and the placenta. We said that. Function of the placenta, two important roles. The site across which nutrients and waste are exchanged between mother and baby. Acts as a gland. It secretes hormones that help maintain the pregnancy, prepare the body for the birthing process, and promote postnatal events such as breastfeeding. Embryonic period. Organogenesis, formation of organs, is beginning to start. Embryonic disc formed by the blastocyst's inner cell mass. Inner cell mass forms three primary germ layers, ectoderm, mesoderm, and endoderm. Different tissues in the fetus are derived from these primary germ layers. Teratogens are particularly harmful in embryonic period, cause severe birth defects. So in other words, guys, drug use, drinking, catching the measles, being exposed to radiation, which is behind me here, can all result in terrible birth defects. Thalidomide, very briefly, mainly in the Great Britain, but in America too in the 50s, they were given pregnant women the drug thalidomide for morning sickness, because in pregnancy, some of the morning sickness can be really a problem. They're up there vomiting every morning. And it formed these terrible birth defects where the babies were born with flippers and stuff. And thalidomide is one of the dark events in medical history. There's still quite a few of those people still alive too. Here's some here. Embryonic period. What's this? This child has got some deformities here. this infant. So the point being, guys, it's very careful how the mother treats herself and handles her own health during this period, because the infant, or the fetus, I'm sorry, can be negatively affected. Fetal period, body proportions change. Fetus is viable at 20 weeks. That means it can live on its own. It will require probably some help. Preterm is any birth before 38 weeks. But you can see here's 28 days, a month, 6 weeks, 2 months, 3 months, 5 months. And you can see it's starting to, by that point, it's starting to look like the babies that we're used to seeing. Quickening, movement of the fetus felt by the mother. Lanugo, fine hair covering the fetus. Vernix gaseosa, white cheese-like substance protecting the fetal skin from amniotic fluid, so the baby is covered in this stuff. Abortion, loss of the fetus at any time. It can be spontaneous, in which case it's often called a miscarriage. It can be induced or a therapeutic. I don't know if we're going to get finished with this or not, guys. We'll try. Maternal changes in pregnancy. Rate of metabolism increases. Blood volume increases by up to 50%. Why? You got two. Respiratory activity increases. Kidneys produce more urine. Nutritional needs increase. Increased hormonal secretions of all these important hormones. Labor, birth of the baby. Forceful contraction, expel fetus from the uterus. Hormones involved. Progesterone, quiets uterine contraction. Estrogen sensitizes uterus to oxytocin. Prostaglandins cause uterine contraction. Oxytocin stimulates uterine contraction. I'm picking up the pace, guys, because time's getting short. Stage of labor, dilation. The cervix dilates. They measure it. Eventually, the water breaks, is the common term. The amnion membrane breaks. Expulsion, placenta stage. And then, of course, after the birth of the fetus, then we have to expel the afterbirth. The placenta will detach and be expelled out. They've already cut the umbilical cord in this case. Pathology, abrupto placenta, premature separation of the normally implanted placenta. I don't know what they'd have to do for that, guys. That wouldn't be good. Choriocarcinoma, malignant tumor of the placenta. Ectopic pregnancy, we mentioned that in the previous video. Sometimes a fertilized ovum gets hung in the oviduct. Placenta previa, it's where the implantation takes place down near the cervix, and the placenta grows over and closes it off. Can be a real problem. Preeclampsia and eclampsia can be serious, can be fatal. But look, I got it right. Down syndrome, trisomy 21. Instead of having two chromosomes at 21, you have 3. Erythroblastosis fetalis, or you got something's wrong with the red blood cells. Highly membrane disease, infant respiratory distress syndrome. Hydrocephalus is commonly called by the good old folks water on the brain. You have water on the brain. Meconium aspiration syndrome. Meconium is like the feces that fetuses produce, and sometimes it floats around and they suck it in. Pyloric stenosis, a narrowing of it's a narrowing of in the small intestine, which causes trouble with the baby eating. Structure of the breast. It's modified sweat glands, actually, realar glands. Nipple, areola, suspensory ligaments. We've got about a minute. Estrogen and progesterone help prepare for lactation or breast. Oxytocin, I said prolactin. Last time is the milk letdown reflex. There's actually 2 or 3 hormones, guys, that work just for that. That's how important it is. It's a reflex. When the baby starts suckling, it causes milk and all to be cranked and released and for feeding. Postnatal adjustments in baby breathing. Established blood through the lung begins because they didn't need it when they were in utero. Mechanisms for temperature regulation. Baby's meconium, here it is here. More organs begin to develop. Here's the whole thing now. We're not going to have time to go over it because we're almost out of time now. Okay, guys, I'm going to have to cut it short. Covered most of it. Maybe I'll get the rest of it later. So Dr. Tom is signing off.